Hi, I'm Dr. Mark Kantos. Welcome to Ophthalmology Insider, an innovative series featuring candid discussions on today's hottest topics in ophthalmology. Talk about money for a minute and talk about the economy. Okay. Now you're practicing in Greece, and we've had in the U.S. some challenges economically, and it's been going on for some time. And certainly, Greece gets headlines in the U.S. about what their economy is like, and your practice is a practice that deals heavily with paying patients, paying for the premium services that you provide. What's the challenges been like for you lately?
Well, it's a tough road, and all the colleagues in the U.S. had to experience it with the back a few years ago in 2008. We were kind of late in falling into that pitfall. I think that it has been challenging, but at the same time, it has been a very valuable lesson in many aspects. Number one, redefine what your personal goals are in life. Two, manage your office better. Three, in a way, patients become more selective in a very tough environment. So we have found that focusing on the important things, which of course I've learned mainly from Eric, which is, always go with your instinct and always do what's best for the patient, will finally separate you from the competition. And definitely a lesson that we've learned is you cannot try to underprice things. Value is always something that patients eventually will seek. So I think that I'm not sure we've been through the crisis. We're hoping we've been through the roughest part. But I think I personally, as a professional, I'm far stronger. I'm more conscious of how much my practice is devoting into research. Now that we have to crunch numbers, I'm not ashamed about it. I think this is what drives me, and this is another thing that I got from Eric's practice when I was training with him, the passion to not only do your job as a physician, but also explore the frontiers. What is there that could be better, and learn from your mistakes.
Mm-hmm. Allon, what's your, here in the UK, where are things at for you? I mean, how do you see the economy, and how is that affecting your, practice? We haven't heard so much about the economy here. It's maybe a little bit steadier, but at the same time, I think there have been ups and downs. So.
Well, the UK is going through the same pressures as everyone else. Yeah. Essentially, the way the kind of health economy works is different to the general economy, and because there's more innovations and more technologies and more treatments and cures that we can offer patients, they're living longer, they want more, they want a better quality of life. There's just a greater expense in healthcare than anything else. So even if the economy is steady, essentially, if you can't increase your healthcare spending or budget significantly more than the general economy, then you're going to have to find ways of doing things more economically. Now, in the government system in the UK, that's always done in kind of in mass numbers. Could you treat 5% patients and be 5% less expensive at doing it? Yeah. But in private practice, I guess it manifests in terms of patients' ability to afford insurance, because in the UK, not all patients are insured. It's a choice. So people that are working with companies will often have corporate insurance with the healthcare companies. But if they don't, then it's their choice whether they want to limit themselves to some of the choices available on the National Health Service, or have the option, if they are privately insured, of selecting their doctor and selecting the technology that they may have available, selecting when they're treated and where they're treated, and having all of that choice. And about 10% of people in the UK do exercise that. But I've got to say that despite all of the difficulties, I suppose, in an environment where you have to be kind of sensitive to cost, the options for treating patients are like they never have been before. And one of the big advantages, training with Eric, is to have that full array of things that you can offer patients: corneal patients, refractive patients, cataract patients. The things that I can offer now, even at the kind of early stage of my consultant career, is completely different to what you would have been able to offer 10 or 15 years ago. So I have a patient with keratoconus. I could be discussing kind of 7 or 8 different surgical treatments for them, and the same for patients that want to be independent of glasses, and the same for patients that have cataracts. So it's for me, it's unbelievably exciting. There's an enormous amount of opportunity. And I agree with John. I don't think the solution is certainly in the private healthcare environment. The solution is not to be cheaper in terms of what patients are spending, because actually they're quite happy to spend money on their healthcare, because for most people it's the most important thing. It's a question of, I suppose, making the right decisions. And if you do act in the patient's interest, then they're going to be happy. And I've actually encountered very little opposition from patients in the private sector to any kind of pricing issues at all, to be honest.
Yeah, and those things all kind of sound familiar to our circumstances, really. I mean, the things that they were describing, and we've been through that turmoil over the last 10 years, really, now it seems like, and we're still surviving it, but it has required us to make changes. I mean, what are your thoughts?
Well, Mark, here in the United States, we're going through the same economic pressures everyone is going through, but the take-home message that I would give to the ophthalmologists watching this are that I think we generally undervalue the value of vision and the services we provide, and that we should offer patients what's in their best interest. We should make a recommendation to them of what we think is best for them once we understand their visual needs, and then we should give the patient the opportunity to make an informed decision with our input on what we can do for them, and then let the patient decide if they want to have a premium product or a conventional product. And whatever they decide, we don't degrade the options. They're all good options, but the patient should have the ability to choose what's best for their lifestyle and their personal quality of life, so that I see ophthalmology as being a vibrant profession, because we can offer opportunities to patients that no other professions can offer. And at the end of the day, what's really more important than vision? So we're in a very good spot in our profession, as long as we stay the road of providing quality care, as John and Allon have both really emphasized today, is do what's best for your patients. If you follow that mantra, you're going to be very successful going forward.
Yeah, and I think that's good advice, and it's true. There was so much doom and gloom that we were hearing, and you probably have heard that too. And at times, that this is, how can you keep a practice going and that sort of thing. But yet at the same time, it seems to work out. And patients do value the services that we provide, even though we have all these other challenges externally that we have to deal with. When it all comes around, it seems to all kind of end up that we continue to move forward, and that sort of seems what it's been doing. So I don't worry too much about it either. Kind of like you guys all have said, we're all, when the sun's going to come up the next day, and there are going to be patients that are waiting for us to need them, to treat them and do the things for them. So I kind of see,
it's vital that we continue to do this, because once we stop offering patients advanced technology, it removes the impetus for industry to keep providing these technologies. As long as patients are looking for better opportunities, there's going to be industry that's going to be there working with consultants like these gentlemen, yourself, who are going to be wanting to invest in new technologies to advance our field. Once we say, we'll sit back and we'll say, we'll just do the status quo, everyone loses.
Yeah, I think that's a good point.